two questions from the internet that are frequently searched. And I put these together because I think that the way they're worded differently is worthy of a discussion in and of itself. So the first is, what's the best way to talk to a loved one about their substance use or addiction? The second is, how do I confront my loved one about drugs?
Love those questions. I think let's talk about the difference between the two.
That's why I put them together, I think.
Yeah. So the first one, obviously, we can all hear that it's a person wanting to more maybe compassionately talk about the substance use. The second one takes a stronger stance and says, I need to show this person.
Confront.
And so the word confront.
Yeah.
As a clinician, I don't have that strong of a reaction to confront, but I do understand that lay people, which is non-clinicians, would. As a psychiatrist, we think about in psychotherapy, confrontation is bringing to awareness anything that is out of awareness. And that's why I smile at the question.
Yeah.
That if we think about confrontation in that way, which is bringing to awareness something that has been out of awareness, then heck yeah, let's go ahead, confront.
Yeah.
So again, doing that with a compassionate stance and taking the approach of curiosity, believing that we don't know it all. And we talked last time about comparing our insides to other people's outsides. So in this case, the family member who's asking about the confronting the use of drugs is comparing their inside. Well, I don't feel like using these substances. I feel totally fine, but that person's use. And that can be less helpful. That makes it that, if you are taking a blaming approach or just talking about what you consider negative behavior, you're very likely to cause the person to shut down or then confront you with something you're doing.
Yeah.
Right? It's like you're saying, well, you have these 2 glasses of wine, and the other person may say, well, you have the 6 cookies. Like, let's talk about who has a bigger problem. And so I think taking that more curious, compassionate approach to say, I don't understand everything. This is what I'm seeing. So again, speaking objectively to the behavior you're seeing, the fact-based components, and saying, this is what I'm seeing. I know I don't understand everything. Tell me a little bit about what you think is going on. Or being able to say, help me understand what this helps you with. Because we do need to take the approach that any human being will only engage in a behavior because it's helping them in some way. It's fulfilling some need. So trying to understand what it is that it's fulfilling takes a more compassionate and holistic approach to it to say, you're such a wonderful human being. You have all these wonderful skills. I love you so much. I've known you these many years. And I've seen in the last 6 months that every time we meet, you have like 3 to 4 drinks. I'm getting a little worried about it, but help me understand what I'm not understanding, or tell me what role is this playing? And the person may say, oh, well, I had a really stressful week. These are actually the only 6 times that I drank. And maybe that goes in a different direction. It may also be that they underreport to you, but at least it gets them engaged in the conversation. And so once we've opened that channel of communication, there's hope for a more robust, more authentic, more real conversation.
So as we talk about compassion and curiosity, there are going to be people who listen to this and think, that's great. That's really good advice. I wouldn't have gotten there on my own, or I need that reminder. Then there are people who say like, wow, you're just being way too soft on him. If I come at it that way, nothing's going to change. So is that approach soft, or is that trauma-informed?
I would call it trauma-informed. It may also be a softer approach. And I would say that for most people, let's start there, because we don't really know what the person's experience is. We often don't even know what their life experience is, even if they're your child.
Absolutely.
Right? Even if they're your partner. When I do intakes with patients, and I used to do outpatient work before I joined this treatment center, I would say often that I knew my patients better than I knew my best friend.
Interesting.
And it's because a big part of my clinical work is trying to facilitate somebody's story and helping them sort of uncover or share what the internal kind of thought process is as they're going through life. And we very rarely, if ever, have those type of conversations with our loved ones, even where we talk to them pretty deeply about things, they're not sitting with me on a weekly basis, sharing what went on and how they thought through things. So really, like there is that level of awareness that one can develop about another person. So really realizing that even my best friends who I've known since I was in middle school or high school, that as well as I know them, and I might say, this is how she'll behave in this situation, I still didn't know them as well as I knew my patients. I think for me, that's what really got me down this path on facilitating somebody's story, that we do not know a lot. And so start with curiosity, start with compassion. And it may be that there are some people out there who do need the kind of stronger boundaries or do need the confrontation. But if we start at a place of compassion, then maybe we'll uncover that. We'll uncover that they do need kind of a more stern approach to the situation. And it's best to start with the compassion and curiosity, because then you're not shutting down the conversation prematurely and making it that then the person just doesn't want to engage with you anymore.
That feeling I'm in trouble or I'm being judged, because you would be.
And people have so much self-stigma already.
Yeah.
There's so much self-judgment and self-stigma. And that sometimes can be the reason they're not seeking support or care, because they're like, I already feel so shitty about myself.
Right.
I don't now want Terry to feel badly about me too.
Right.
And there can be this component of like building on shame. Like, I have enough shame of my own. Please don't pile yours on.
Right.
Because then that might become too much. Another thing that we haven't quite talked about that I would want to mention is that a person with a substance use disorder is at an elevated risk of suicide, right? Or a suicide attempt. Because there is that inability to cope with what life has put in their plate. And it could be either because we have limited or like a narrow range of coping strategies. It could be that the situation has overwhelmed your capacity to cope. And that's really what trauma is. And so when a person is using substances, we already know they're in that state of overwhelm. So when we pile on our shame on them or pile on our judgment, we may actually push them further out into that overwhelm. And so that, again, is another reason to let's start with compassion and curiosity.